Hello, everyone. Welcome to the SAG-AFTRA Foundation's The Business Program, an introduction to mental health. I'm Janani Subramanian, Associate Director of Programs here at the Foundation. Now, without further ado, it is my pleasure to introduce our panelists for today, Melissa Wax and Rachel Cherty. Thank you both so much for being here.
Hi, thank you for having us.
Yes, thank you.
So I'm Melissa Wax.
I'm Rachel Cherty.
And we're both licensed clinical social workers, and we work together at New York University's Tisch School of the Arts, and we provided mental health support and counseling for actors, filmmakers, writers, dancers, and other visual and performing artists. We worked together for over a decade at NYU Tisch, and we are now both currently in full-time private practice in New York City.
Okay, and I have some housekeeping notes. You're welcome to put your questions in the chat, and if you feel more comfortable submitting your question anonymously, someone from the SAG Foundation staff will be sending a link to a Google Doc where you can do that. Just a reminder that while we are both psychotherapists, this program is not meant to serve as a clinical evaluation for any specific individual. We would instead like to present ways of thinking about mental health specific to actors and performers and introducing tools for self-assessment. We'll be putting resources in the chat and in the description of this video when it's published.
So just to give a little background, as we mentioned in our introduction, Rachel and I worked together for over a decade at Tisch School of the Arts. And our specialty in actors and other performers is really that it's not so much that, you're a unique group of people who have specific mental health issues. It's that there are specific challenges to being in this field and being a creative person. Our focus is more that we sort of speak your language, that we understand what the challenges are, particularly in making a living, in the ways that it affects you emotionally to do this work. That we sort of understand the business, we understand the language, we get the difference between a manager and an agent. So that it's kind of the terrain of what it is to kind of be a performer, to be an actor. And so it's kind of a shortcut in understanding your training and the kind of foundation of what you do. But I think why we want to address mental health in this community in particular, and I think there have been some questions about that, Rachel is going to spend a lot more detail talking about sort of what we discovered working with artists, and she's going to get into some more detail in that area.
And we're just going to kind of go back and forth a little bit and sort of take different pieces of this. So I'm going to talk to you a little bit about why, what's specific to working with actors and performers. First of all, it just sort of randomly happened that May is Mental Health Awareness Month. So the timing just worked out kind of kismety. As Melissa said, we spent a lot of time working at Tisch School of the Arts with undergrads and grads, and we interacted with the departments, and we learned over the course of our time there, just like the ins and outs of the training, both in the, for actors, for filmmakers, for dancers. As Melissa said, we've worked with, all the performing arts. And one of the things that we kind of repeatedly came upon was this idea that there's little separation between sort of who people were as performers and who they were as people, that one's identity is closely linked to the work. And not that this doesn't happen in other fields, but it happens in particular with artists, with creative people, because you are your own instrument. If the work is coming from something personal, from somewhere inside of you, it's a very different thing than perhaps being an accountant. I can't actually speak to being an accountant, but my experience with accountants has been that, it's not so much a sense of themselves that, gets jeopardized if they lose a potential client. Unlike with actors, if you are auditioning and you don't book that gig, oftentimes the feeling is it's a rejection of you. And that is something that is a, common phenomenon for all creators and artists, the kind of recurring rejection that is unfortunately a part of the business. And, again, it feels like I'm not right for the part, or I'm not tall enough, I'm not short enough, I'm not the right ethnicity. It's more about like, it feels like a personal rejection, a rejection of you as a person. And, there is this, as you all know, an intense level of scrutiny that happens when you're a performer. And I mean, it is, as I was saying, you are your own instrument. So it's your physicality, it's your voice, it's the way you look, it's your height, it's your weight, it's all kinds of things that sort of factor into what gets scrutinized on a daily basis when you are in the process of, trying to get work. I think, in addition to the rejection and the scrutiny, there's also the kind of working freelance, being a gig worker, and what it's like to have the kind of constant stress of finances and the financial precarity of what it means to be an artist. And, there's also like an intense amount of work that goes into prepping for auditions, prepping for whatever the particular gig is, and oftentimes it's time and energy that doesn't necessarily amount to booking something, which means it doesn't necessarily amount to a paycheck. And Melissa and I were talking about this, that some of the people we work with have joked about the fact that they should get paid for all the time and energy that goes into auditioning. Unfortunately, as you well know, that's not the way it works. I think that, again, another phenomenon that's particular to performers is that there is constant uncertainty and unpredictability. And that is what is consistent and predictable, that it's inconsistent and unpredictable. Again, in relation to sort of what is particular to performers, there's, a lot of self-esteem is tied into one's ability to work. And again, this is true broadly speaking, but it's particularly true, I think, for actors and for performers. And when gigs are not being booked, when jobs are not, happening, I think that there is self-doubt and insecurities that come up about why. And oftentimes with people who are in the arts and auditioning, you may not book a job and you don't necessarily know why. You often don't get any kind of feedback as to sort of, what happened that you weren't selected for the particular role. And in the absence of information, creative people tend to create. And oftentimes what happens is people create unhelpful narratives that can feed into a negative impact on mood and sense of self and self-esteem. I think one of the things that, again, Melissa and I have come up against and have seen with a lot of people we work with is what we refer to as the isms, in the industry, whether it's racism or sexism or ageism or homophobia or transphobia or ableism. And again, this is just like not an exhaustive list. This is just kind of a sampling of what we have heard about through our clients. And again, we'd be remiss in not sort of identifying that this has a real impact on people's sense of self and their sense of self-efficacy when they're bumping up against, all these isms. And, oftentimes, again, it leads to a sense of frustration and anger and depression, and it feels, very personal. I'm not saying that it's not personal, but there is just this kind of, again, it happens in every industry, but it is particularly difficult when it feels so pointed. And for actors and performers, oftentimes they encounter, any combination of these things. Obviously everybody has been living through this pandemic, and, there has been a lot of stuff in, all the in the news and in all kinds of publications about the fact that the next pandemic, is really a mental health pandemic. And I think, Melissa and I have felt like that has been the case for a long time. I mean, obviously it's been exacerbated during the time of the pandemic. But again, anxiety, depression, OCD, substance use, existed prior to the pandemic, but it has really taken a toll on a lot of people who felt incredibly isolated. And, for many actors and performers and creatives, it meant no work. it wasn't just isolation. It wasn't working from home, even though I know people started doing Zoom things. It's not the same as having, being on set or being in a theater and having an audience. And, when shoots shut down and jobs got punted or disrupted or, disappeared completely, I think this was, for many people, a panic. And some people felt like, will it ever come back? Will the theater ever come back? I know we're based in New York and we work with a lot of theater actors, and this fear of what am I going to do if this doesn't come back? Not only how am I going to make a living, but how am I going to make meaning out of my life if I can't do the thing that I have been trained to do, that I feel compelled to do? Having work is, crucial for all of us, obviously, but I think in terms of feeling like, having a purpose and making a contribution to the world, if you can't do the thing that you are meant to do, how do you make meaning in your life? And for many artists, the way that they feel most fully themselves is to be doing their craft. And again, many people completely stopped working and there weren't options. And it has created this, I think, intense need for people to sort of reconfigure and try and sort out how to take care of themselves. And I don't know if you have anything to add to that before I start talking a little bit about how to assess oneself.
Yeah, no, I think I'm nodding just because I think even though, we work with a similar population, I think we consistently see the same things in both of our practices, and that, I would imagine that's a shared experience for many of you.
Again, I think we've talked a lot about sort of both when we were at Tisch working with undergrads and grads, and over the years as we've grown our practices and we've worked with, so many actors, talking about sort of how do people, assess when it's appropriate to, or necessary even, to get treatment, and how do you yourself, sort of take a look at what's going on and say like, okay, now's the time maybe to get some outside help. Maybe it's not enough to talk to my parent or my partner or, my friend, and I think, there are changes in the way people are thinking, but there's also changes in behavior that sometimes are an indication that it's time to seek out some help, whether it's changes in sleep or eating, changes in concentration, motivation, difficulty enjoying things, feelings of, hopelessness or helplessness, excessive worry, panic, and in addition, as I said, to sort of the thinking, some of the negative thinking, sometimes there's also physiological symptoms that come along with anxiety and depression. And in particular with panic, we hear about a lot of people sort of talking about or fear that something is physically wrong with them because they're having heart palpitations or they're having excessive sweating or, a whole host of physiological side effects that can be a result of anxiety or panic. Also, again, if you feel like there is a significant change in your behavior or people in your life are expressing concern, if you're tearful, if you're having thoughts of hurting yourself, it's a good time to, really reach out to somebody. Obviously, you don't have to be in crisis, and probably better not to be in crisis, not to wait until you're in crisis to reach out. And Melissa is going to talk a little bit about that, about seeking out treatment.
Yeah, thanks. I think that's a helpful segue. So, I want to spend a little bit of time, just talking about sort of when and why, you might seek mental health treatment. Like, when is the right time and what are the right reasons? And obviously that's going to differ from person to person, but, really the question is like, how do you know when it might be warranted for you? And for some of you, you may never have, pursued therapy or counseling before. For some of you, you may have a history, but you may have taken many years off, and is it time to go back? The two main bullet points that I'm always kind of thinking about when I'm doing an assessment on someone are duration and severity. So I think as Rachel was kind of ending on kind of a crisis or getting to a place of, like whether it's really about your health or your safety, that's one end of the spectrum of severity, right? But it doesn't have to be all the way over there. I think severity is sort of your own assessment. Like, how severe is it for you? If you're somebody that, it's never affected your ability to kind of get up or get out of bed or get to work, and all of a sudden, whatever's going on with you is sort of disrupting those things for you, then that's more severe for you. The other question is, like duration, like how long has this been going on? For some people, I think, the amount of time they can tolerate not feeling good can really, really vary. So, and, we sort of sometimes talk about this in terms of like transitions when we were seeing like, college students where like, it's understandable for the first month, that you start college, or for, I would imagine for this population, like maybe some of you moved out to LA and that was a transition for you. And you kind of imagined and anticipated that the first month or so might be bumpy. But if it's been going on for 3 months, 4 months, longer than is normal for you, I think that again is a really good indicator. Like this feels like a longer process than I imagined it would be. Again, how disruptive is it? Is it affecting your ability to work? Is it affecting your relationships? Even if you are functioning in these areas, could you be functioning better? Sometimes it's really about the quality of your life. Like things are okay. You're making money, you're, maintaining your job, your relationships, but you're not able to kind of enjoy the way that you hoped or have been able to in the past. To me, that's a quality of life issue. And also, like, is this unusual for you? Is this out of character for you? Are you somebody who's never felt these things before? Or also, do you have a history of this? And like, oh, this feels familiar. I remember when I was back in grad school, or last time I made a move, it was a hard transition. So, those are things that, I think are important for your own self-assessment. It's not an objective kind of thing. I think when Rachel and I both, I think in our practices are doing like a first assessment on somebody, what we really want to know is like, is this unusual for you? There's no kind of like norm. It's just sort of like, what is your norm? You are the best judge of what, feels kind of like within the realm of what feels manageable to you. So, I want to move into a little bit too, just about like what the benefit of talking to a therapist might be as opposed to a friend or family member. And just to say that for many people, they can get through these sort of challenges with the help of their support system, of their community, of their friends, of their families, of their religious community. That oftentimes is the first place people start. But sometimes that they find that even though that's helpful, it isn't sort of resolving the things that are going on with them in their mental health. So, what a therapist can provide is objectivity. And obviously we have a professional training and a way to kind of assess in, a very sort of like objective thing, where we're looking at things like you're eating, you're sleeping, you're concentrating. We have a sense of sort of what constitutes, a diagnosis of depression, or really what anxiety, what the signs and symptoms of anxiety are. And sometimes hearing that cluster of symptoms has a name and is something that other people deal with and can be managed and addressed can actually be very reassuring and very validating. For other people, it can be concerning and worrisome. Like, they've never thought of themselves as somebody who's dealt with those things before. But again, I think as Rachel said earlier, ideally, if you are seeking treatment when these things are just starting to come up for you, they are often very manageable and really treatable. And they don't get to that sort of severe place, or they don't last as long as, longer than you would want them to be. Also, I think one of the benefits of talking to a therapist is, you don't have the burden of relationship, right? So, a lot of times, like, the worry is like, if I am upset and I'm going to my partner or, someone in my family, how is it going to affect them? What is it, how stressed are they going to be? Are they going to worry about me? And that need to sort of like be concerned about someone else or take care of their needs or feelings is relieved when you're talking to somebody whose job it is just to be focused on you and listen to you. So I think there can be a lot of relief in that. Even though it can also feel strange that you don't know this person, but it's sort of designed that way because, that objectivity and that sort of lack of relationship is sort of designed to give you some relief from caretaking of other people in that situation. Also just like that you can say whatever you want without having to, worry about the impact on other people. Just to note too, and I mentioned this earlier, but, some of you may have been in therapy before, or it's something that you've done regularly, or, even on medication to that degree. And sometimes, when you've taken a break from that, there can be some resistance or some shame about resuming or returning to mental health treatment. I think even in the best of circumstances, when you sort of know yourself well and you're, can able to say like, yeah, I've been here before, that it can feel, I've often heard people say like, I feel like a failure. I feel like I wasn't able to kind of, do it on my own or, keep myself in this good place. And that it can feel like they're moving backwards. But I think that, the way we often talk about it, first of all, like mental health, like so many other illnesses and things that we deal with in our healthcare system can also be cyclical. The same way that like something like a back problem, sometimes like, you can really have excruciating pain in your back that you can't walk. And then you can go for a long period of time where you're just fine and you can do all of the things, and then something triggers it and it comes back again. I don't think of that as a failure. I think unfortunately there's so much that can get attached to our mental health, but I think that if we can see it in that sort of more objective way, it can be helpful. And therapy is an ongoing process. So, sometimes, the first thing that brings people to therapy is some kind of precipitant, it can be something that is distressing them or, something that has happened in their lives. And there's a clear precipitant, this thing happened and I'm feeling this way and I want to go work on it. Or I need help with it. But for other people, depression and anxiety can be a little bit more amorphous. Like it can kind of feel more like a wash, like it's this thing that's coming back. And again, to use the analogy of like back pain or, sometimes it's like a dull ache and sometimes it's severe, right? So you want to be able, ideally, you go back to the doctor when the ache is dull and you can really kind of treat it earlier. But I think again, that feeling of like, you can only go to therapy if something's really wrong. And I think that oftentimes the best time is also like to either be preventive or also even just to be exploring something, that there's like, you want to make a change in your life. Rachel and I think both see a lot of people, even as they're transitioning out of the business, that can really be, it's not like that's a problem, but it's a big decision. And I think as Rachel was outlining earlier about sort of how connected your work can be to your identity. I think that like, somebody saying like, I need to talk to somebody because like, I'm questioning whether I really want to be an actor anymore. Is this really the way I want to make my money? That can, bring up all sorts of feelings and identity issues, even though for some people that is the right path for them. So it really can also be just about like exploring a process where you're coming at it from a place of growth or understanding yourself better or making a change. Okay. So I'm just going to check real quick to see if there are questions that are coming up as we're talking. And I know that there were some things that came in the chat recently. Maybe Rachel can take a look and see as I'm talking, but I think I'll spend just a little bit of time talking about taking first steps. Like how do you get connected to a therapist? Where do you even start? And this is meant to be like very practical. So, I think I'm talking at first about sort of the emotional barriers but for some people it's really like, I don't even know where to start or how do I pay for it? And this narrative that, therapy is so expensive or it's cost prohibitive. And again, I think, we're not going to get into the details of that because everyone's, kind of healthcare and situations are different, but there are resources, just to say in the chat, that are kind of general mental health resources that everyone has access to that are free, and a lot of support, especially for the performing community.
I'm going to interject because one of the questions was about somebody who made an appointment with their primary care doctor, trying to get a referral, mental health referral, and that this person was told that they basically couldn't be given one because therapists are inundated with appointments after the pandemic, and this person was referred to a website, a clearinghouse to find a therapist. Okay. And that was, the person felt very defeated and discouraged by that. And again, to Melissa's point, I mean, yes, there are websites and there are, portals, and we're going to give you some information about that. But again, I mean, part of why we're here is to sort of talk about what's specific to performers, why get into treatment, but then there's a question of how do you get into treatment? Yeah. And, Melissa's going to talk more specifically about that, but there are, yes, with the pandemic, there has been a run on therapists. However, there are tons of therapists out there. There are institutes, there are places that provide, therapy and are eager and interested in having, working with creative people. And again, we can, give some more details about that. But one of the things I know that Melissa had actually made sure to put in the resources was the Actors Fund, which, again, is a great resource, which perhaps many of you know about. Sorry, go ahead.
Well, I just want to say, too, that, I understand that there is sort of a narrative out there that, like, you can't get in to see a therapist right now, that the pandemic has just, and I actually do think that that's a narrative, just to say. I fully understand that you may, come up against, you might make a phone call and someone might say, I'm so sorry, I'm totally booked. But I get that can be discouraging, especially when you're in distress, right? To kind of feel like it's such a big step to reach out for help. And if the first thing you're hearing is like, sorry, I can't help you, or I can't provide you with what you need, that can also really shut someone down. So, it's interesting because the practical ways that we were starting, and this question is helpful, in the sense that, yes, a primary care physician is a good place to start. If you have a relationship with your primary care doctor too, like if that's somebody that you feel knows you. But just to say that, oftentimes too, like really the route can also be through your community, talking to your friends, talking to, and that can be a hard thing, I understand, if there's, embarrassment or shame, but oftentimes people come to us through friends of friends. Yep. Where, someone's in treatment with us and they say, I have a friend, and I can't necessarily see them because they're friends of my client, but I could refer them to Rachel. So, names get passed around, and oftentimes it can feel frustrating, and sometimes you can have a chain of conversations, but eventually I guess my advice is to stick with it, because I don't think the narrative is true that there are no therapists available right now. I just don't. And there's also, it depends on what you're looking for, but there's so many ways to kind of engage in treatment. There's also group therapy. And sometimes that is, that's literally a group of people. Groups are rarely ever closed. They can often be rotating. There are just so many sort of different points of entry. I think it can be really overwhelming in an internet search. So, our main advice really is to try to do it in a more personal way, to talk to people. And again, whether it's a doctor or a friend, someone at your work, I think if someone's open enough to say, oh, my therapist, ask them, could your therapist give me a referral to someone? Here's my situation. There's also like listservs that therapists have where we also kind of can post and say, we're looking for a referral for this kind of, person. So, let me also just talk a little bit, and this is just the more specifics of when you do reach out. And again, because, sometimes people don't even know what to say. I think the things that you want to be asking about are availability. How quickly can you get in? You want to ask somebody, it might be that they could see you, but not for a few weeks, and the question is, can it wait? How urgent is it? What are their fees? What insurances do they take? Are they meeting in person or virtually? That's a huge thing now. It's a completely different, terrain that we're doing. And almost all of us are now working virtually. And in some ways that makes treatment so much more accessible, where you don't have to physically get to someone's office, and maybe you can grab a room on your lunch hour somewhere. So I actually think that can be such a big help. But some people don't feel comfortable with that. And many therapists are now opening up for in-person and a mix of those things. How or who directed you to this personal clinician? Oftentimes, like if somebody contacts me, I often ask, who gave you my name? Just because I want to understand what is the point, how did you get to me, so that I can sort of trace it back and understand some context. That can be very helpful for a therapist. And what are the general concerns you want to address? Is it, have you just recently lost someone? Is it a relationship concern? Is it your mood? Is it substance abuse? It doesn't have to be a very detailed thing, but just a general sort of, these are the topics that I'm looking at. And you want to know, can you connect with them briefly on the phone? Most therapists will take at least 5 or 10 minutes and talk to you on the phone. And oftentimes that's even like to see, like, does your schedule work with their schedule? Is that, we don't want to put you on a hamster wheel of, kind of running into, situations. So like if someone calls me and I know that I don't have the time that they need, if I'm going to make a referral, what I will do is direct them and say, this person can only be seen on this day. Are you available? So that we're trying to reduce the amount of back and forth. So, those are all things that these are very practical things, but I think those are things that can be intimidating and overwhelming for people. And we're hoping that just having some of these things in mind will not feel so, overwhelming. I'm going to look through the questions, and I'm going to let Rachel talk a little bit about what to expect in a first session.
And I think hopefully, some of the questions have been answered or will be answered in the next, several minutes. So just in terms of a first session, again, it can be challenging just to sort of take the step to find somebody to actually to make that initial contact. But I think that, different people work differently. Sometimes people have forms to fill out because they want to get a general sense of sort of, who's stepping into the office or who's stepping into the Zoom room or whatever. So they'll have you fill out some really basic information about sort of, what the impetus is for making the appointment. Other people, like Melissa said, will offer to have a phone call or to have an email exchange, just to sort of get a sense of, so you can have a moment of connection prior to starting the process. Again, in a first session, I think my experience and what I will often say to people is, you tell me what's most relevant to you. If it's going to be somebody that you work with over time, obviously you will get to know each other and details about your history will come out. There is I think, again, in this initial session, it's most important to say, like, what's the precipitant? What's the main issue? What brought you to the point where you decided it was worth your time to get invested in some treatment potentially? You are also free to consult with any number of therapists. And I know that this can be an issue about finances, but I also think you can potentially ask to have a brief phone conversation with somebody prior to a full initial session. Again, you don't have to make the commitment. Sometimes you can't make the commitment after meeting somebody once. Sometimes you need, a couple of sessions to sort of determine, does this feel like the right fit for you? And Melissa will, talk a little bit more about fit. But it is an opportunity for you to suss out the therapist and for them to suss you out and to sort of figure out in that first session, is there enough here that it makes sense for us to sort of go on to maybe have a next session or a couple of sessions to get a sense of each other? Yeah,
so, I am going to talk a little bit about how do you assess a good clinical fit. And actually, this very specific topic came up in one of the questions, which is, any advice about how you find a good therapist for you. The budget concerns, which I think Rachel talked a little bit about, but also, someone talking about sometimes a person is not a right fit for you and you can't keep jumping around trying to find people necessarily when you have limited finances or insurance will only go so far. So that's totally fair. Again, I think, a lot of the feel of like the practical pieces can be dealt with over email, in a brief phone call. So when it comes to location or budget or insurance, those questions are answered quickly. What I would really talk about is sort of the clinical fit, right? How does it feel? Is this the right therapist for you? And I think that jumping around piece also is about it's a lot to tell your story, right? It's a lot to sit down and have a first session with somebody, and it can be draining. In and of itself, that can be an emotional experience. In some ways, I think it can be helpful to kind of meet at least two people if you have that luxury, so that you feel like you're making a choice, that you have some point of comparison and that you're assessing how you felt. But again, to keep in mind, some people don't want to do that. So some people want to sort of have a consultation and then see is this someone I can work with? One of the things I just encourage you to pay attention to is, how do you feel in that session? Do you have reservations? Do you feel uncertain? Did you feel, here, just some general questions to ask yourself. Did you feel heard? Did you feel understood? Just to go back to kind of this issue of the isms that we were talking about, I think it's completely understandable when it comes to, there are many people who, in looking for a therapist, they want to see, if they're a person of color, they also want to see a person of color or even a person of the same race. There can gender, it can be about wanting to see somebody who's the same, sexual orientation, somebody that sort of familiarity or feeling understood in an experience can be really important.
But I also want to say, even if somebody is not, again, doesn't have your skin color or doesn't have your sexual orientation or, there are other specific things that you may be looking for, it doesn't mean that they can't have compassion, that they can't understand, that they can't help you. Again, you're entitled to your own preferences, but I also think you don't necessarily have to have the same experience as somebody to be able to help them.
Right. So, that's a very personal choice, right? I think, and again, that could be a scenario where maybe you're sort of assessing that in talking to two different people and asking those questions, how comfortable are you talking about race? Is that something that feels, and especially if that's important to you and that feels like that's something that is, a piece of what's bringing you in. Just some of the other things to, be asking yourself, even in terms of just looking through my notes here. Okay. So the questions that they asked you, did they feel helpful? Did they feel appropriate? Did they feel respectful? I think if the questions felt intrusive or judgmental, that should be a red flag for you. Did their boundaries seem appropriate? If they shared anything about themselves, which, can be a tricky thing, did that feel appropriate and relevant to your needs, as opposed to, did you feel like they were kind of talking about themselves? They felt the need to tell you something about them. The focus really should be on you. So it's natural to be curious and want to know things about a therapist, and I think you asking those questions are totally fair. But also having a degree of personal information about your therapist impacts your experience, right? As I was saying earlier, that objectivity, that lack of, burden of taking care of them is in part what is helpful about therapy. So you need to be able to feel comfortable in asking them questions, but you also, I think, need to feel like there's an appropriate boundary, that this is really about you. And really, I think that the main thing to be going on is your instinct and your gut feeling. Oftentimes people will come to us or go to other therapists and they've had a bad fit, and they didn't quite know why or what they're looking for. And oftentimes when that's happened, my question to them will be, tell me what didn't feel good to you about it. What wasn't working for you? I'm always curious to know that. Again, not to be afraid to ask questions. And maybe if you have, had some experiences that didn't feel good, going into that next, that session, that consultation session, really with some clarity about what didn't work for you can be really helpful in kind of streamlining how you get to a good fit.
I think that can also sometimes be a barrier to seeking out treatment. Again, if you've had a prior experience that felt like, for whatever reason, it wasn't a good fit, or, it was not particularly helpful. But again, there are many different therapists out there, and it really is oftentimes like, despite how qualified somebody is, it might be a fit issue. And as Melissa said, to sort of not give up. And again, if you haven't turned to your community for resources, that might be a good time to ask somebody if they know, if their therapist could recommend somebody, or if they recommend their therapist. That may be a way in.
I'm also just going to sort of wrap up on this part of it just with a very practical piece too, which is also sometimes it just give yourself a certain amount of time. Like whether it's like, I'll see this person for a month, or I will go for 2 sessions or 3 sessions and check in. Sometimes if you're not sure, or if someone comes to me and they're kind of like not sure, then, we can kind of treat it as like a short-term situation. Like, all right, well, let's meet a couple of times. Let's see. It can be like an extended consultation. I understand, again, that if your time and your resources are limited, that could maybe feel daunting. But that also doesn't mean that you're not going to get something from those 3 sessions, even if you don't continue to work with that person. Even if what you end up with is actually, I think I really do need to see a therapist who is the same race as me, because that's really important to me. I think that's important information, and I don't think that's a waste of time. Short of a therapist doing something harmful to you, I think that's a difference, but not feeling like it's the ideal fit. I think it takes time, and it's important to invest in something that feels like the right fit. There's one question. I think we're sort of at the end of our kind of didactic presentation. And just one question I can answer somewhat, quickly, going back to something I talked about earlier. Someone was sort of talking about like an anxiety behavior, that, like a scratching or a picking that, when you're stressed, how do you know when you need to see someone as opposed to finding a way to stop yourself? And how would you find that kind of therapist? Totally, very common question. Again, I go back to duration and severity. How long has this been going on? Have you been doing this for years? Is this something that like you've always dealt with, but is it finally becoming disruptive to your life? Is it so severe that you're bleeding, and that bleeding could get infected? I think it's again, that's up to you to kind of assess like the degree of disruption to your life. But how would you find that kind of therapist? I will say that, like, again, that's about inquiring. Do they specialize in this kind of thing? A Google search can also be helpful in that way. A search engine like Psychology Today, many, many therapists will list specialties that they have. So that is, certainly an easy thing to do.
And also just in terms of like a portal like Psychology Today, yes, not only do they list, people tend to list their specialties, but they'll also oftentimes list what insurance they take. So that, that is a way of sort of doing a search based on whatever your particular concern is, and also your insurance, if you have insurance. Because I know a lot of people also lost insurance during the pandemic, which is a whole other thing. And I mean, just to also this piece about insurance and finances and cost, and there are a lot of places that work on what's called the sliding scale. And again, in the pandemic, I think I certainly have gotten requests, and I've certainly referred people to various institutes. There are a lot of institutes that are based, throughout the country that will see people for, again, some nominal fee, based on whatever it is your income is. So there are resources, and there is a recourse when you are struggling financially.
So there's some questions here, in the Google Doc. I think that some were actually submitted beforehand, and there's sort of a theme just as I'm reading about it, which is, a phrase I'm going to actually lift from someone I worked with, which is compare and despair. Like how do you, kind of like, especially with social media, right? Like seeing friends who book a job or they're on set and you're happy for them, but you're also sort of envious, and, and also like, that feeling of of like scrolling through and feeling like everyone's doing better than I am, or feeling, somebody also talked about the isolation of it. The one thing obviously about social media that can be great and the internet that can be great is that it can be a point of connection, right? There's can be, a Facebook group or something that's like so specific to, what you're looking for, the kinds of people you want to be in touch with and talk to. But obviously the underbelly of that is, the way that things are curated and the way that things look. So, like anything, the same way that like I would say that like sometimes like, having one drink makes you feel good and having three, it can be a problem. I would say the same about social media, that like scrolling through, if it sort of feels like, okay, well, that was nice. I got to see these things, but this part of it made me feel bad. Take a pause. Walk away and really acknowledge and be able to kind of name for yourself, like, this actually isn't helping me right now. This is making me feel worse. A phrase I often use with people is sort of like, it's important to stay in your lane. What is your goal? What are you working on? What can you do kind of to work towards what you want, as opposed to this narrative that everyone else is doing better than me? What would it look like for you to be doing better?
I'm just going to, go back. There was a question about what is sliding scale. I'm sorry, I didn't mean to sort of toss that out there without explaining it. Essentially, it means that the fee is set depending on, your income, what you can afford. That's what a sliding scale is. And again, lots of people have sliding scales, but in particular, there are institutes and institutions that, groups of therapists that will provide will set your fee depending on what your income is.
And also just to say that, once you're working with a therapist, they often will be flexible with their own fee. And so a sliding scale can also be like within, the course of working with someone, where when you maybe started, you could afford it and then you lost your job and you want to continue the work, therapists will often be flexible with you about that. There's a question here, too, that I would love to talk about, which is our experience of Zoom therapy versus traditional therapy. And Rachel and I have really talked a lot about this. It is such a mixed bag, I would say, both. And I say this on our end and on our client's end. I think on our client's end, there's a lot of things that people feel are really great about this. As I was talking, like the barriers to treatment. I've actually had people who I stopped working with 10 years ago because they physically, my office was too far away. And now they're back because they can very easily see me virtually. And that's been wonderful. So I think that like there's an ease that can happen. For some people, there's also almost like this, like it actually can feel a little less intimidating to sit in a room with somebody, and maybe it can feel, like a little less personal. Sometimes can be helpful, right? That it doesn't feel so intense, or that it feels like there's a little bit of a buffer there. And I will say that I have plenty of people in my practice that a virtual session feels almost the same as an in-person session. However, I also think that there are a lot of things that can be missed, and I was, just telling Rachel that, interestingly, here's something that on the side of the pro of virtual sessions, the office I'm in right now is a rather large office with a ton of space between my chair and the client's chair, mostly for social distancing purposes. And someone that I work with came to see me here in person and actually said that they preferred to continue working with me virtually because it felt so much more intimate. Because here I am up close on their screen and they're up close with me, and that there was a connection. They felt physically almost too far away from me, which I thought was interesting. But I will also tell you personally on my end, like the technological glitches of things, like when, it's disruptive, like when someone's upset and in the middle of a feeling and the audio goes out, or, I miss something. I think that there can be, like anything, like the difference between, performing on Zoom versus performing with an audience, right? There is something about sitting in a room with somebody that brings up different feelings. So again, I think it's a very personal choice. I will say that in my practice, and I think in Rachel's as well, that we're both doing a mix at this point, but that also, is really preference of client and therapist.
I also actually have people who prefer just to be on the phone excuse me, they spend so much time on screens that their preference is to just talk to me on the phone, which is, again, something that I'm happy to accommodate if that feels more comfortable to the client.
Yeah, so I'm just looking through. There's also a lot of questions also about like social media, social media addiction. I think it's probably its own topic, to be really honest. But I'll just say that from my experience, I think it is rather common. I think we all have some degree of addiction to our phones, and especially since the pandemic, our reliance on these things for connection. I think it's up to you to assess, again, like what are the benefits of this to this and what are the downsides? Where are the areas where it makes you feel badly? And like anything, how do you moderate your use?
Yeah, and I think to that point, I know people that I work with who've decided to take it off their phone because they don't want to have immediate access. So they, can only access it through their computers. Or again, sort of setting certain time limits. Like I'm going to look at it for 15 minutes in the morning and I'm going to I'm not going to go on it for the rest of the day, which may be challenging for a lot of people. As Melissa said, it's also a way for people to, be connected. But if it is causing you distress, it is worth really looking at how to challenge yourself to minimize your use.
Yeah, so there's also some questions here. There's a question here about, poor memory. Is that considered a mental illness? What I would say is that memory is obviously a neurological function, and that if you really feel like there's something disruptive, that is a medical thing to get checked out. However, oftentimes when people are dealing with symptoms of depression or anxiety or even grief, focus can absolutely, and the ability to concentrate can absolutely be disrupted. So it can feel like you're losing your memory, but actually it may end up being sort of not in and of itself a mental health illness, but part of a cluster of symptoms that could look like depression or anxiety or grief.
Or a byproduct of also sleep disturbances. When people don't sleep properly, they're, not only are their emotions more all over the place, but also, cognitively, you can be impaired from not, taking proper care of yourself, not sleeping, not eating properly. I mean, again, all, worth ruling out anything medical when you have something that is seemingly neurological, but it can definitely be a byproduct of a lot of other things.
This is an interesting question. Do we work with non-actors, and as a group, are actors easier or harder, or is there a preponderance of certain types of problems? So, yes, we both absolutely work with non-actors, but I would, and again, I'm going to give like the most, I think, typical therapist answer, which is it's both. Are they easier or harder? Yes, right? Listen, I think actors in some ways have easy access to their emotions, most of them, right? And that your currency is emotion and that your language is emotion. So for many actors, to be in therapy is sort of a comfortable experience, right? Because that is sort of what you're asked to access, and that's probably what's drawn you to this work. And yet, on the other hand, is it harder? I think I would link that to is there a preponderance of certain types of problems? I think the challenges that actors face that Rachel really detailed in the beginning of this presentation are a very specific challenge to this industry. And I think there are just some things about working in this business that are, again, that it's not that they're harder than or more stressful than other fields. It's the way that they sort of impact your sense of self. And that's what I would say that I think we see in general with most creative people, that how tied it is to sense of identity and self, as opposed to this is my job and I want to do a good job, at my work, but it doesn't feel so much who I am.
I think another thing about actors is often sort of separating themselves from the work when they are invested in the work, when they're working on a project that may be challenging in particular ways, and sort of how to, at the end of the day, at the end of shooting or the end of, a show, how to actually kind of check back in with themselves and leave the role behind. And sometimes that is a different kind of problem, but that is something that we also see. When you're living inside of a character and that character starts bleeding into, sort of your own personal life. that's another set of challenges.
Yeah. So maybe we could end on this. Well, there's two more questions. Maybe we'll take, and then I think we're almost at time. But so the one question. I'll let you take that one, and I'll just answer this one that I think has been in the chat in the doc for a bit. What are some great ways or tools to fight depression from not working and stay motivated despite lack of work/booking? I wish I had an easy answer for that. I think that is a very common question and something that brings a lot of people to us. I will say that something I think is important is just like staying connected to your community, not being isolated. I think that like understanding and feeling like what you're going, like even the people who look like they're doing great, sometimes when you open that up and you really talk about what the challenges are, you kind of can see, and this goes for social media too, that like from the outside, things don't always, look as rosy as they do when you really start to talk about them. So I think not being isolated, really kind of having a community of other actors, I think like physical connection and interaction, like meeting for lunch, going over, like have somebody read with you, have somebody help you, put something on tape. I think that can be helpful. The other piece of just like fighting depression, again, I think can be very, very particular to who you are. But if there's any messaging I think we're both trying to give, it's just don't wait. Don't wait to get help. Don't let it get so bad. Don't sort of wait till it gets worse. Try, like anything, the earlier you treat it, the better off you will be and the better control and management you can have of it.
I'm also going to address, this question about like the length. How long does it take to, for therapy to sort of be effective, which is, again, sort of such an individual thing. And I don't think, neither Melissa nor I are cognitive behavioral therapists. That is a particular kind of therapy where, again, Melissa and I do more psychodynamic therapy, but cognitive behavioral therapy can target particular ways of thinking and particular behaviors, and sort of saying like, okay, well, here's the homework that we're going to do to address this particular behavior or this negative way of thinking. And that tends to be shorter term in my experience with cognitive behavioral therapy.
And just to say, that can sometimes have a protocol too. Like, we're going to, like sometimes they will say, we're going to meet for 10 sessions. Here's the protocol. Here's what we're going to do. But that is a very specific kind of work.
Yeah. Right. And people do seek that out. People really want something more concrete and more tangible. There's also a question about meditation. And I would say, there are all sorts of things that people do to take care of themselves, whether it's exercising or meditating or, various hobbies that people have. I think it all can contribute to a, healthier, more rounded, better sense of self. Anything that you can do that, brings down your stress, brings you pleasure, do it. Give yourself permission to do the things that make you feel good. And, I know, again, that we're in a particular time in the world, and there is a lot of stuff happening, not just in our individual lives, but in the world at large. And that also can be incredibly overwhelming and can lead to people feeling pretty despondent. And I think, again, just like with social media and with, sort of involvement in any number of things, you have to sort of figure out what is right for you. How much do you engage with, what's happening in the world? How much do you engage in social media? And moderate that for yourself as well.
Just to jump back to just the last piece, though, of the question of how long does therapy take,
yes.
Just to say the CBT, cognitive behavioral therapy model that we were giving, that, some people work that way. It's a number of sessions. I think just to explain a little bit, the way Rachel and I work is a more open-ended kind of process. And that can feel daunting and overwhelming. So what I would say in that situation is, first, therapy really is up to you, right? Just like how long. And for some people, it's, it is limited by resources or, the ability to kind of make the sessions. But the clinical piece that I would talk about is what's bringing you in, what is the conflict or what is the symptom, and not necessarily is it better or is it resolved or is it gone, but to what degree is it improving? And if it is improving enough that it's no longer disruptive to your life and you feel you've gotten what you want from it, great, then you pause. The thing about, and I use that word pause just to say that, that we have sort of a way of talking about it in our field, which is that therapy doesn't necessarily ever end, right? It is like an open door, and we have people who sort of come in and out. It can end with one therapist and start with another therapist. There are some people who do it once in their life for a certain amount of time. It really is dependent upon what you want out of it and sort of what you're looking to get from it.
Thank you. I like how I just kind of bypassed that altogether. And there's this one question about sort of how to help somebody get help, essentially. And I think, it's often easiest when you come from a place of care and concern. I mean, if somebody feels like you're judging them or you're telling them that they're, out of their mind, they're probably unlikely to be amenable to hearing whatever it is you have to say. If you yourself have had personal experience with therapy, that's also a good thing to be able to make use of in talking to somebody who you feel like needs help. If it's been helpful to you, it's easier to say, like, I've had my own personal experience and this was really helpful to me. But ultimately, people are going to do what they're going to do, and you can't force anyone to do something that they're not prepared to do.
Yeah, or ready. Sometimes it's also about timing,
Yep.
And sometimes it's planting a seed, and then, at a certain point they feel more ready. So I think that's it. Hopefully we've answered. I know some of these questions are, very specific, but I think I'm hoping that we've, addressed most of what is on your minds, and clearly there's a need for this. People are really participatory and really want to know about their mental health, and so we're happy about that. That's a good thing.
We also understand that this is like a kind of overview, and it's kind of like a, mental health 101. And, again, we tried to sort of talk specifically about what it means to be an artist and, how you as artists should potentially seek out resources. But obviously, a lot we didn't cover. And, I know that there's all kinds of information in the chat, so please take advantage of that.
So thank you.
Thank you.